phones, otherwise you listen to all that nonsense going
on. Okay, everyone, we've got a decent number of people now and a few more coming in. So I will start slowly and let other people come in. Welcome everybody to the launch of the Cheshire and Merseyside Food and Planning Policy Toolkit. I'm Andy Turner. I'm a public health consultant in the Office for Health Improvement and Disparities North West. Formerly of this parish, I was a consultant with Cheshire East up until a few months ago, and interested generally in the many ways in which places we occupy influence our health, for good or ill. So very happy to have been asked to chair this webinar today. I won't go into lots of background detail on this specific project of the toolkit, as Matthew will cover that in his slides shortly, but I'd just like to say that I am a fan in general of anything that encourages planners and public health colleagues to work together for the benefit of the public's health. Planning and public health have always been closely linked, and it's somewhat of a artificial distinction, I think, that has grown between the two professions in more recent times. I think we have the same aspirations, and I always say, that I think that planners can probably have more of a direct impact on public health, even than those of us with public health in our job titles. So I think not only was this project a generally good thing and useful thing to do anyway, but I think it's become especially timely and launches at an opportune time. There's lots of things happening at national level around planning and health, with updates to the national planning policy framework, emphasising and re-emphasising the focus on health and well-being, new guidance on local plans, on design codes, and various other things on the horizon as the planning and infrastructure bill progresses through Parliament. So hopefully this event and the toolkit being launched today will further help public health and planning colleagues to navigate the complex systems we work in and work together to produce more of what we all want, which is places that actively create good health and well-being. So before I pass on to the more interesting people, just some quick housekeeping. If you just go to the next slide, please. Thanks. So please do feel free to introduce yourselves in the chat. Turn off your microphones and cameras unless you're speaking, please. A member of the team, thought this is just for speakers, will raise their hand, the virtual hand, with 1 minute left, to see you've got a bit of a warning to wrap up. There will be an opportunity for questions after the main presentations. So after that, either please raise a hand or add your questions to the chat. We'll try our best to get round to all of them, but we'll address anything that comes up in the chat that after the meeting in the summary notes as well, if we can't get around to it today. The meeting will be recorded to share with colleagues unable to attend today, so please be aware of that as well. Thanks. And then lastly, just onto the agenda, please. So just to make sure you're in the right session and just to give you a quick summary of what's happening today. So first we'll be hearing from Matthew Philpott just to give some background information on the project, where it came from and the work plan. Then from Matthew Morgan from the Quality of Life Foundation on their recent work on planning for healthier places. Then Nicola will provide an overview of the toolkit that's being launched today. And then finally, we'll hear from various local authority colleagues on good practice and what's been working around planning and health. So that's it from me for now. So I will pass on to Matthew. Over to you, Matthew. Thank you.
Brilliant. Thanks very much, Andy, and thanks for sharing today. Thanks to all of our speakers as well. So my name is Matthew Philpott, Executive Director of Health Equalities Group, with the public health charity that is delivering the Strategic Obesity Project for Cheshire and Merseyside, which is kindly being funded by Cheshire and Merseyside Cancer Alliance. Next, please. So just in terms of some background to the project, there's probably quite a lot of people on the call who are familiar with this work now, but just a bit of positioning. This project started actually 3 years ago now, and the aim of it is to establish reduction of overweight and obesity prevalence as a significant agenda item for all stakeholders. It's this idea of building connectivity across the system, funded by the Cancer Alliance, as I suggest. The Cancer Alliance decided to invest in this because overweight and obesity is now deemed the second most prevalent risk factor in terms of cancer prevalence. And we do take a cancer lens to this where appropriate. So we're driving systems connectivity across the system in Cheshire and Merseyside, very much trying to take more of an upstream preventative approach, mainly working around social determinants of health. It's not just an issue for public health, and there's quite a lot of people I can see on the call already who are not from public health or not from local authority public health teams. And the idea is that we're really working with stakeholders from across the charitable sector, the VCFC sector, private sector for that matter, plus wider stakeholders within planning, housing, the health and care sector, transport, etc. So trying to take that system-wide distributed approach. And we're now delivering a number of core work streams in this third year of the programme. And I'll talk to you in a bit more detail about those in a couple of slides. Next, please. So just to rehearse what probably most people know who are in the room now already, the impact of excess weight and poor diet. Obesity and poor diet increase the risk of conditions, including CVD, type 2 diabetes, osteoarthritis, etc. We can see in this chart now just how much overweight and obesity actually contributes to some of those core NCDs. The longer an individual lives with overweight and obesity, the more likely their risk of developing earlier disease or diseases is probably most likely, multimorbidity. And in terms of the cost, well, we know that there's extreme cost in terms of the NHS, but wider societal costs as well through early mortality, morbidity, inability to work. Certainly a very current issue at the moment in terms of policy. And modelling using 2021 data indicated that the total societal cost is now at 98 billion in terms of the UK. Next, please. So in terms of the different work streams that are now being delivered for this project, we have a work stream which is building capacity with third sector colleagues, and a lot of that this year has been through our delivery of our Why Wait to Talk training. We have a work package in there on weight stigma training for healthcare staff. So we've developed a specific program for healthcare practitioners to educate and address quite high prevalence of weight stigma in healthcare settings. Did a lot of work with lived experience groups to model that over and above literature reviews, and a lot of testing out of that. And that's being pilot delivered to HCPs in primary, secondary and community care at the moment. The third work stream is our work around social housing, addressing food insecurity. So quite a number of people on the call today. I think we're at our workshop a couple of weeks ago where we had 80 delegates in the room sharing current practice and trying to strengthen cross-sector collaboration in addressing poverty and also food insecurity. And we have our fourth lever, which is our food policy and planning lever that we're going to discuss today, in particular, our new online toolkit. Next, please. So what about planning and overweight and obesity? So planning levers can contribute positively to healthy weight within communities. There's a strong focus, understandably, in terms of this piece of work on obesogenic environments. So looking at the proliferation of unhealthy food establishments and those barriers in accessing fresh and healthier foods, plus limited access to green space or lack of active travel infrastructure. And part of what we're trying to do is understand some of these opportunities for both planning and public health to collaborate, and that might be through the local plan process, unsurprisingly, but also through health impact assessments, SPDs, etc. So we're trying to facilitate work towards more of a shared vision for spatial planning across the sub-region in Cheshire and Merseyside. Next, please. So the rationale for this, it can be much easier to access unhealthy foods. I think people are really well aware now in many neighbourhoods across Cheshire and Merseyside, but the planning process can help to establish healthier spaces for communities. And what would that kind of good food environment look like? It can be potentially something that connects growers, producers, and consumers in terms of one kind of ecosystem. Planning can help to control the proliferation of poor quality food and encourage access to healthier food. So tackling access to healthier food can also meet several corporate objectives. And this is something that we do bring out in some detail in terms of the digital toolkit that Nicola's going to talk through. So over and above addressing food systems, it can help to meet objectives around physical activity and mental health, very much around climate change, community cohesion, and biodiversity. And there are a number of different tools and also contexts in which we can try and work together between public health and planning, such as the local plan, design codes. These are just some of the tools within the NPPF that can support creation of healthier and sustainable food environments. Next, please. So in terms of the planning work stream objectives for this year, really, we've tried to continue facilitation and collaboration between public health and planning officers. And after our main workshop that we ran in March last year, I think it was quite clear that a lot of the feedback on that was to develop specific tools, whether it be around guidance or briefing notes, to assist planners in developing policies that support healthier weight environments. And from that, we've looked to develop this food policy and planning toolkit. We had a kickoff meeting, which was on the 16th of July, bringing together colleagues from planning and public health, and tried to talk through how using the local plan policy might facilitate healthier food environments. What will good look like around this? Key themes to be considered as part of the toolkit, and how to add value locally and support planners to embed robust food policies within existing frameworks. Next, please. So in terms of the process, we wanted to make sure that this was a piece of co-design, so making sure that there was ownership from our local stakeholders. So a working group was established that met on a monthly basis from July onwards, including representation from local authority planners, from public health, from our combined authority in Liverpool City region, and colleagues from OHID as well. A big thanks and shout out to our colleagues at Sustain. We had a lot of expert input and guidance from the Planning Food Cities national lead at Sustain, who helped us to create a lot of the content and shape some of this in terms of the final product. And that working group has contributed to quite a lot of examples of good practice that exist in each section of the toolkit. And like I say, Nicola's going to talk you through this in a bit more detail after our keynote presentation. Next, please. So very quickly, just in terms of the toolkit, it sets out the rationale as to why we have developed the toolkit and how the planning process can help to bring about sustainable local food systems. It presents a range of policy themes, quite a wide range of policy themes, in fact, and associated topics that can be considered as part of that local plan making process to create healthy food environments. And we use very much a kind of similar template that runs through the toolkit. Nicola will talk you through that momentarily. The aim of this really is that it gives local authority, public health teams and planning officers this idea of taking a pick and mix approach to policy making, which is really indexed to their own local context. So hopefully there's enough content in there, and there's a lot in terms of different ideas and different policy themes that can be used at specific contexts within your own locality. And in addition to that, this was another thing that came out in terms of the consultation, the co-design. We've also included a downloadable checklist that can help to assess the potential impacts of a planning application on healthy food environments, and that's a downloadable PDF which comes as part of this overall package. So that's it from me, just a bit of kind of context and background in terms of the wider project. Many thanks to colleagues from Sustain for their input in terms of this piece of work, and to all of our local authority partner organisations who've been part of the co-development process. Big thanks to all today's speakers and our chair, Andy, and it's back to you, Andy, in terms of introducing our keynote speaker from the Quality of Life Foundation. Many thanks.
Thanks very much, Matthew. Okay, on to Matthew number 2 now, the director and co-founder of the Quality of Life Foundation. There will be time for some questions and answers at the end of Matthew's presentation as well. So either write them in the chat or save them up and put your hand at the end. So Matthew, I think you're sharing your own slides, aren't you? So over to you whenever you're ready.
Thanks, Andrew. I will get my slides up and share them with you. I'm hoping you can see them there. Can you see them, Andrew?
Yeah, they're working. Thank you.
Fantastic. Thank you very much for the invitation to speak today to celebrate the launch of a brilliant new resource for creating healthy food environments, the Food Policy and Planning Toolkit. My name is Matthew Morgan. I'm the director and co-founder of the Quality of Life Foundation, and I'm going to talk you through a little bit of our work and how this new toolkit fits into it. The toolkit provides a clear, actionable way for planners, public health colleagues and decision makers within both local authorities and partner organisations to think about the places where we live and to create better outcomes for both people and the planet. The social, environmental and economic conditions that have arisen to make this sort of guidance necessary are well known to most of you, and they're highlighted very well by Matthew in the previous slides and on the site. With diet-related ill health estimated to lead to approximately 70,000 premature deaths annually, representing around 12% of the total number of deaths. But I want to share with you a positive vision for place that this work embodies, and that the organisation of which I'm the director, the Quality of Life Foundation, wholeheartedly supports. So the Quality of Life Foundation is a charity committed to making health, well-being and social impact central to the way we create and care for our homes and neighbourhoods. We do this through research with universities and on our own to build the evidence base and to create innovative new models to evaluate and engage with residents about their place. We implement good practice through the provision of services to local authorities, registered providers and industry, and we advocate for change through guidance and policy improvements with local and national government. We've taken the past 6 years looking at the housing system and the way that homes and neighbourhoods are both created and cared for, and have come up with outcomes that we would like to see, many of which are relevant to this work. The first of which is an enabling environment for prioritising health and well-being, of which webinars like today's are a very good example. Engaged and equitable communities, an evidence-based planning system, a stewardship plan for the long-term social impact in every place, and the consistent evaluation of health and well-being outcomes. Our concept of quality of life is holistic, taking in health and its social determinants, also an individual's physical, social and psychological well-being, and the lens through which many in industry and local authorities view health and well-being, which is through short-term social value and long-term social impact. We want to see an evidence-based planning system, and to help our own and others' understanding of what makes a good place to live, we've created a quality of life framework that seeks to encapsulate the drivers for better health, well-being and social impact in place. The 6 themes are a sense of control, health equity, which includes healthy food choices, a connection to nature, a sense of wonder, getting around with ease, and connected communities. Many of the themes and sub-themes will be very well known to you, but it's helped us to bring these together to understand what quality of life in place is like, and it's enabled us to use the framework in a variety of ways to develop social impact strategies, to enhance community engagement, to conduct design reviews, to create stewardship plans, and to enable the consistent evaluation of health and well-being outcomes through post-occupancy evaluation that we've now carried out for housing associations, local authorities, volume house builders, and master developers. The good news is that health and well-being are moving up the national agenda. For the past 3 years, we've been working with partner organisations through thought leadership and collaboration, and in the Better Planning Coalition, we've managed to highlight the need to address health inequalities to national government. In both the National Planning and Policy Framework and the recently published Planning and Infrastructure Bill, the need to address health inequalities is being written into national policy in a way that is finally beginning to recognise its importance. It's now widely accepted that the built and natural environment can have a positive influence over people's physical, social, and mental health and well-being. If planned and designed well, with input from built environment and public health professionals, these environments can encourage healthy behaviour and support reducing health inequalities between social groups. Qualities such as a walkable environment free from pollution and the availability of well-maintained green spaces can promote physical activity and well-being. Achieving this level of healthy planning and design requires those working in local authority, public health and planning teams, and other built environment professions such as transport and housing to consider these factors when improving, designing, and creating sustainable places where people can thrive. Councils can have significant influence over many of the factors that I've outlined through implementing current powers and through developing practices that prioritise health and well-being. Given the need for a comprehensive approach to shaping healthy neighbourhoods, links could be made between all areas of local government and themes that make up a healthy neighbourhood. Instead of relying on the NHS to treat the symptoms of poor health, we should shift our focus to creating health. This means providing the conditions in which people can be healthy and helping them to be so. Achieving this requires a partnership approach, and the planning system is one tool local authorities have for doing so. These are 3 pieces of guidance that we've published in the last year, empowering healthy places and creating health and well-being for local authorities. And in the past week, we've also produced design codes for health and well-being, which are for local authorities and industry to find out how design codes can enable better outcomes for people in place. And I'll be posting a link in the chat for a webinar that we'll be holding at the end of the month to share. So it's in the context of this work at a national and local level that we see the launch today of the Food Policy and Planning Toolkit. All of the tools outlined through the toolkit can support local access to healthier and sustainable food environments. So this prompted me to ask and hopefully to enlighten you what a healthy food environment is, how can the benefits of it, and how can we look at the benefits and achieve them in your area. The healthy food environment is a setting where people have easy access to affordable, nutritious and culturally appropriate food that supports good health, including the physical, economic and social conditions that influence food choices and dietary behaviours. Key characteristics include the availability of nutritious food with sufficient access to fresh fruits, vegetables, whole grains, lean proteins and minimally processed foods, as well as the presence of grocery stores, farmers markets and community gardens. Affordability and economic access is achieved when healthy food options are competitively priced and accessible to all income levels, and when policies and programs ensure affordability for low-income households. Physical accessibility can be delivered when healthy food outlets are conveniently located, and with the reduced presence of food deserts, areas with limited access to fresh food, and food swamps, areas with excessive fast food outlets. Policies and regulations can be supportive of this, with laws limiting the concentration of unhealthy food outlets near schools and residential areas, and through incentives for local food production and sustainable agriculture. Culturally appropriate and equitable food options ensure diverse food choices that respect cultural, dietary preferences and traditions, and nutrition, education and awareness is important in promoting healthy eating habits and informing consumers about food choices, with clear food labelling and regulation to help make people informed decisions. And finally, sustainable and resilient food systems can be achieved with local and sustainable food production methods that reduce environmental impact and over-reliance on highly processed and unhealthy food sources. The benefits to people's health and well-being of healthy food environments include improved nutrition through greater access to fresh fruits and vegetables, reduction in obesity and diet-related diseases, helping to prevent obesity, type 2 diabetes, cardiovascular diseases, and some cancers. Proper nutrition can lead to better child development, affecting cognitive development, academic performance, and overall well-being. And addressing food deserts and increasing access to affordable, nutritious food benefits low-income and vulnerable populations, reducing health inequalities. As anyone working in health knows, and our recent project with the Institute of Health Equity demonstrates, it's within everyone's power, from local authorities to investors, developers, and operators, to reduce health inequalities through their work. But what I particularly like about the approach that the toolkit takes is the way that it includes many of the co-benefits of healthy food environments. Economic benefits include lower healthcare costs, with fewer diet-related illnesses, leading to reduced healthcare expenses. Healthy food environments can provide a boost to local economies by supporting local food markets or urban agriculture. Healthier workers and students have higher energy levels, fewer sick days, and improved performance, increasing productivity. Social benefits include stronger communities through farmers markets or community gardens, greater food security with reliable access to affordable, nutritious food, and cultural preservation by promoting diverse, locally sourced food options, which help to preserve cultural food traditions. Environmental benefits include sustainable food systems, since encouraging local food production reduces carbon footprints. There's less waste because stronger local food system and education on food use can lead to less food being wasted. And there's biodiversity protection because sustainable farming and urban agriculture practices support biodiversity and healthier ecosystems. What's so good about the toolkit is the quantity of case studies of projects at a local and national level that are already seeking to create healthy food environments, with examples including projects at a local level, such as the West Cheshire Food Partnership, helping communities access the food support they need, to guidance from organisations such as our own or the ever-resourceful TCPA, and policy progress at a national level, with changes to the MPPF and food acknowledged as one of the 13 national infrastructure sectors. Finally, I'd like to leave you with a few thoughts on what I think is key to overcoming the barriers to implementing this work and ensuring success for yourselves, your organisations, and the communities you serve. First of all, get to know your communities. Understanding community needs, demographics, and challenges is key to effective partnerships. Engaging residents through surveys and meetings builds trust and ensures solutions are relevant and community-driven. Collaborating across policy silos, making sure that health and planning intersect with housing, transport, and education, breaks down silos, fostering holistic solutions such as designing walkable neighbourhoods that promote physical activity, which maximise impact while avoiding redundancy. Working through funding constraints, we all know how constrained everyone is at the moment, with reduced budgets needed to address increased need, and limited resources can hinder progress. But partnerships enable resources to be pooled, grants to be accessed, and cost savings to be made, like co-locating services. And advocating for long-term investment in prevention supports sustainable community well-being. Fostering better communication and shared goals ensures alignment among stakeholders. Regular meetings, shared platforms like these, and common success metrics strengthen collaboration. Public engagement fosters transparency and community trust. And finally, leadership. Strong leadership drives partnerships, secures funding, and champions policy changes. Empowering community voices and emerging leaders fosters equity and lasting impact. And a shared vision ensures sustainable health and planning improvements. And when I say leadership, I mean at a personal and an organisational level. I think it's possible for everyone to lead in their job, in their team, in their organisation, and to feel that the work they're doing is worthwhile and achievable. So in the words of yesteryear, when it comes to healthy food environments, we can, we will, and we must.
Thank you. We have got time for questions for Matthew. If anyone has any, please put your hands up or put them in the chat. I was just going to ask Matthew, thanks for your presentation. I told you offline earlier that I like the work that the Quality of Life Foundation does. Is really accessible stuff. It also sounds relatively common sense, doesn't it? You know, a lot of these things that, you know, that are full of core benefits if we do that, if we do things this way. So as part of your work, have you also looked into some, you know, why has it stopped being the norm? What got in the way of kind of producing healthy places?
I think looking back, there's obviously a historical context for planning and public health, and the fact that planning came out of public health imperatives, and I think that there was a moment or a series of moments in which that path diverged, and I think it's been particularly acute over the last 30 years that we've seen a lot of the movement in terms of policy and practice diverging between public health and planning professionals, and I think it's over the last 5 or 10 years that we've seen public health and planning professionals starting to work more closely together, and we're now seeing policy coming back into line with that more collaborative working. So I don't know what the exact cause was of the rift, but it's not natural, and it's one that I think is something that we're all working to realign and make sure that we're all working more closely together, because it, as you say, is common sense, and it just the thought of trying to plan without people's without health and well-being outcomes in mind is crazy, and it's all to the benefit of everyone that we're starting to see the changes we're seeing through the national the MPPF and the planning infrastructure, but it's still not moving fast enough, and I'd still like to see health in the first paragraph of the MPPF, but it's, you know, changes are being made, and I think they're positive ones.
Yeah, thanks. So cautiously optimistic.
Yeah.
So, well, thank you, Matthew. So I can't see any hands up. If there's nobody got any questions for Matthew.
Just before I go, I'm going to post in the link some of the guidance that we've created for local authorities, empowering healthy places and creating health and wellbeing. And as I say, we've just produced new guidance for design codes for health and wellbeing, and there'll be a webinar for that at the end of the month. So do come along and find out about it.
Well, yeah, thank you, Matthew. Yeah, please do post them there. That sounds really interesting. Thanks. Well, in the absence of any further questions, then we'll move on to Nicola for an introduction to the Food Policy and Planning Toolkit, please.
Many thanks, Andy. I'm just going to take a brief amount of time this afternoon to take colleagues through the format and the functionality of the toolkit. And as Matthew's already mentioned, much of the content within the resource has been agreed and compiled with the support from the Cheshire and Merseyside working group. So thanks to colleagues for their contributions, and obviously thanks again to Sustain in terms of the expert support that we received from Gillian developing this toolkit. Thanks, Beth. So just to add that the final version of the toolkit was agreed in December in terms of the content. And this also enabled us to include reference to the new National Planning Policy framework. We've since been working with a creative design agency to build the online resource, to offer the interactivity and allow users to navigate between the relevant sections of the toolkit. So just very briefly, you can see that the toolkit has been comprised of 4 key sections, and you'll see this when you have the opportunity to go into the online resource. The first is an introduction and a brief guide in terms of how to use the toolkit. A section addressing the planning tools at the disposal of local planning authorities that can be used to embed robust policies. A section looking at the planning policy options, offering some examples of the types of policies that can be applied to create healthy food environments. And then finally, a planning applications assessment and monitoring framework, or checklist, as we've referred to. And you can see each of these sections are on the home screen as you enter the resource. Thanks, Beth. So just looking at the content now in a little more detail, what you will find at the start of the resource is the rationale for the development of the toolkit and how the planning process can help to create healthier spaces for communities. There's a section on how the planning process can transform local food systems to prioritise health and the health of our planet, giving careful consideration to design in terms of how we create vibrant and healthy neighbourhoods. And as Matthew's already mentioned, this is very much looking at how contributing to a good food environment can support a range of additional priorities. There's a brief how-to in terms of using the toolkit, a section on local plan making and taking decisions on planning applications. So acknowledging the importance of a strong local policy framework in creating good food environments and how this can support the decision-making process. And then finally, suggestions on how food growing and production can be integrated into neighbourhoods. So whether this might be creating spaces for food growing or creating attractive health enhancing environments with productive landscapes, whether this be urban or rural, tackling climate emergency, and also creating a healthy food economy. Thanks, Beth. So you can see on this slide a screen grab from the toolkit itself. This is from the section on planning policy tools. And there are a number of tools that are listed. You can see those on screen, and they're available via various tabs. So, for example, the local plan, sustainability appraisals, supplementary planning guidance, and so on. And by clicking on each of these tabs, users are then taken through to an overview of how that particular tool might be applied, some examples of best practice, and also links to further useful information. And where possible, we've included case studies from within the sub-region and beyond. Thanks, Beth. So the section on planning policy options explores 5 key themes, which are broken down into topics. So you can see the topics there listed: food growing and production, improving access to food through good food retail, economy, access to healthier food in the home, at school and workplaces, and access to healthier food in the public realm. And each theme is then broken down into specific topic areas. So if we take food growing and production as an example, we might look at topics such as edible landscaping, allotments and community gardens, agriculture and horticulture. And then each topic will provide information on specific aims, the policy principles, and wider strategic objectives that particular planning policy option might meet. It also includes links to the evidence base, further information, and again, case studies for this particular approach. Thanks, Beth. So just to give an overview of the planning toolkit checklist, this has been developed to be used by internal consultees to assess the potential impacts of planning applications on the food environment. It's very much complementary to the content within the toolkit itself. The checklist covers those 5 key themes in terms of the policy options. It offers the possibility for council departments to respond to the most relevant sections according to their responsibilities. And this was actually developed at the request of non-planning professionals as a tool that might be easy to use in terms of perhaps limited resources or knowledge of the planning system. So the checklist isn't a substitute for any formal planning assessment tools, but essentially what it might do is enable more planning applications to be considered within that context of the healthy food environment, and also allows us to capture data which then might be collated for monitoring and subsequent policy review. Thanks, Beth. So just finally, by way of a recap and in terms of using the toolkit, it's very much being developed to support planning authorities embed local policies that can positively impact on promoting access to a healthy, sustainable and affordable food environment. It does provide a suite of planning policy options, as we've said, supported by a range of information and case studies. It looks at different policy options that might be appropriate in different areas. It's not a one size fits all. We know that areas across the Cheshire and Merseyside sub-region will differ in terms of their priorities and their geography. So the toolkit is very much about providing that vision of how the planning system could contribute to a more sustainable, healthy food environment. And to acknowledge that many of these policies are already underway or in place within local planning authorities, and that other planning policy options have been inspired by authorities from further afield. And we know that councils can't achieve this vision through the planning system alone. However, to change the food environment, we must at least use the planning tools that we already have in our power. So that brings me to the end of my slides and the overview. And finally, just to say, we will provide details of how to access the toolkit as we draw the webinar to a close. Thanks, Andy.
Thanks very much, Nicola. We are nicely ahead of schedule, actually, so if anybody does have any questions, we've probably got time for one or two. I was just going to ask Nicola, if that's okay. So this is really good, and obviously based on work done in Cheshire Merseyside with Cheshire Merseyside case studies, but more broadly applicable as well, isn't it? It could be applicable anyway. So I just wondered if are there any plans to kind of disseminate the tool more widely and open up for other places to use as well?
Yeah, absolutely. We'll certainly make the toolkit publicly available. So it's not specific to Cheshire and Merseyside authorities and those that have contributed. We very much want this to be a useful resource for anybody. So we will be following up with wider dissemination plans.
Well, thank you. Okay, then I'm not seeing any hands or questions in the chat, I don't think. So we will move on then to our next set of speakers. We've got speakers from various local authorities. I'm not sure if Helen has joined us yet, but we've got Charlotte and Esther from Cheshire East Council and Knowsley Council respectively. So if I pass over to you, please, Charlotte, first.
Okay, thank you very much. I shall try and get my slides to work properly. Let's have a look. Slideshow. Look okay?
Yeah, that's come up, thank you.
Excellent. So, hi, yeah, I'm Charlotte Roos. I'm a senior planner, work at Cheshire East. Bit of background re-plan making. Cheshire East adopted a local plan strategy back in 2017, and then it had its second part of the local plan, the site allocations development plan, since 2022. And obviously they both conform to the current MPPF. So it's a good place to start to look at the updated MPPF and how that fits in with health, basically. So in December, we had a new MPPF. It brought some significant changes, such as mandatory housing targets for local authorities. They had previously been advisory only, and changes to the calculations in housing delivery, changes to the green belt, looking at grey belts, but also, as we've already heard from previous speakers, a greater emphasis on healthy communities and how to achieve that. So we had additional wording in the MPPF about tackling childhood obesity, strengthening policy to promote health. Sorry, that noise is my dog. You stop it. That's right, calm down now. Strengthening policies to promote greater health and prevent ill health and reduce health inequalities in deprived communities. Just take that off. Yeah, it's better. And this is the new paragraph that they gave us to enable support, healthy lives through promoting good health, addressing inequalities in the most deprived and the least deprived communities, and talking about safe and accessible green infrastructure and sports facilities, local shops, allotments, and walking and cycling provision. Another specific update to the NPPF was about hot food takeaways, and this gave has given local authorities the means to refuse applications for hot food takeaways and fast food outlets within walking distance of schools or places identified as having adverse impacts on health / pollution or antisocial behaviour. And on a more local note, it's quite interesting to note that since our adoption of the SADPD in 2022, we have actually had a local policy, Retail 5, which restricts the location and hours of operation of hot food takeaways, specifically in Crewe. At the time of the examination, we wanted this policy to cover the whole of Cheshire East, but the inspector at the time only conceded to Crewe because it was the most deprived. But it's interesting to note that that's now embedded in the NPPF. Also, prior to the NPPF update, Corporate Policy Committee in October last year adopted a healthy food advertising policy which restricts the content of junk food advertising on their own premises. And this has now been endorsed by 6 of the 9 Cheshire and Mersey local authorities. So focusing on local plans, the local plan has over 200 references to health, and it's clearly a cross-cutting issue. We've got references to housing mixes that ensure decent homes, flood risks, minerals, pollutions, travel plans, open space provision. And then our main health and wellbeing policy, SE3, which talks about partnership working to reduce health inequalities. We also require rapid health impact assessments on all major applications in Cheshire East. It ensures opportunities for healthy living improvements and health and wellbeing through the encouragement of walking and cycling and good housing design. And it also talks about communal growing spaces, including allotments, garden plots within developments and small-scale agriculture and farmers' markets. That has actually been put into practice on one of our bigger housing allocations that was in the local plan, 175 homes in Knutsford, but we had very strong planning conditions on that allocation, and it included the allocation of allotments and community gardens. And this is just a screenshot of the development, which is now well underway, and I've pointed out the allotments which back onto some existing allotments just adjacent to this development, and then you can see the amount of green space that's been allowed to the north of the housing. So just a quick recap, the NPPF, as we know, has been updated, and there's new policy requirements for national planning, and obviously Cheshire East's next local plan will comply with what the new NPPF says. However, that's a very long-term process. The last plan took 10 years, and we're only just seeing things getting built. So day-to-day development plans use existing policies. So what's next? Nicola's already said that you welcome the reforms for the national policy and these changes that give local authorities more power to make the case for promoting good health, and that reforms represent an important step towards creating healthier places for communities to live and work. So finally, just another thing to bear in mind, that national development management policies may well be on the cards. The government has committed to a consultation in the spring of this year about further changes, policy changes to the NPPF, and possibly making national policies, including national policies for decision makers. So if we do get generic development management policies, then the evidence base and the toolkit will be incredibly important to give examples of how we can improve health and how we can help planners to plan better. And that's it from me. Thank you very much.
Brilliant. Thank you, Charlotte. We were going to do questions at the end of all the local authority presentations, but as we've got enough time, we have had one in the chat there from Ben. Not sure, Ben, if you'd like to and you're able, would you like to ask your question in person? Or if not,
yes, certainly. It was just about this the detail around hot food takeaways, and I just wondered how that, if and how that might extend to sort of larger chains.
I think it's just interesting that the impact on the surrounding areas is now being thought about perhaps more than it used to be. And if we can get good examples of where that's worked well, then hopefully it might cascade down to other examples of different food outlets. I admit it's terribly difficult because you're dealing with a lot of vacant properties, and a lot of councillors are very keen to have, food outlets versus empty properties. So it's a tricky one.
Thanks, Charlotte. And yeah, I think my understanding, Ben, and please do feel free to correct me, or Matthew might come in as well. It doesn't extend to places like McDonald's, KFC, etc., because they're counted as restaurants. I think, Charlotte, is that right? It's a different category.
I'm not entirely sure, but yeah, that sounds sensible. Yeah.
Matthew?
Yes, I think it's to do with classification, and unfortunately, it's very difficult to get that to stick in terms of a restaurant. What I was going to ask actually was a completely different question, Charlotte. The last slide was particularly interesting, and in terms of that consultation that we're expecting around national development management policies. As a planner, what would be most helpful for you to see as something that could come out through those potential new policies that will be pushing the MPPF even further in terms of trying to actually develop healthier food environments and sustainable food environments? What for you are you hoping to get out of that by way of potential policy change?
I think more of a policy hook, because we're writing the local plan, and if there's something we can hang policy, obviously, we cannot go above and beyond the MPPF. That's a no-no. So it really has to be written into national policy to provide the policy hooks for planners to then write their own local policies.
And what might that policy hook look like in that case? Or what would be the most advantageous type of hook that would be something that you would be able to then pin local policy on?
I'm not sure entirely. I think just perhaps more acknowledgement about the connection between what we're building and the lifestyles that people then adopt. Yeah. I don't know specifically, but I'm sure there's lots of clues in the toolkit.
Thanks, Charlotte. And other local authorities may want to answer that as well. So thank you, Charlotte. Nice to see you. I always enjoyed working with my planning colleagues when I was at Cheshire East. Okay, next we've got Esther from Knowsley Council, please. Esther, if you're ready.
Yeah, I will just put my PowerPoint on. Scott's joining me as well. He's around somewhere. I'm just sharing this, so just let me know when it's popped up.
Yes, that's there, and I can see Scott as well now. Thank you. Welcome, Scott.
Yeah, okay. Okay, just let me set this up right on my screen. Okay. So hi, for anyone who doesn't know me, I'm Esther. I work in the public health team in Knowsley Council, and you're telling me Scott's there. I can't see him. I trust he's there. Scott, do you want to introduce yourself?
Yeah, I'm definitely here. Yeah, my name's Scott Brett. I'm the lead officer for planning policy at Knowsley Council.
Thanks. Okay, so we're just going to do a quick run through some of the planning and public health policies that we've changed or adopted over the last couple of years. I'm going to make a little apology first to anybody who heard me speak at a Food Active thing around commercial determinants of health a couple of months ago, because this is very similar. But I think that's just, you know, when I was doing the presentations, I'm not apologising for saving a little bit of time, but actually when you look at the commercial determinants of health and the work that we're doing in Knowsley around there, there's so many overlaps, so there are some similarities in the presentations. So I'm not going to go into massive detail about Knowsley as a place. I'm hoping most of you will have some kind of flavour. So the important things are we've got high numbers of people living on very low incomes and below the poverty line, and that brings about all those associated poor health outcomes, and a lot of those are related to food accessibility, availability, and the quality of that food that people are eating as well. So we have a very good relationship with our planning department, us in public health and planning together. And I say over the last couple of years, we have done quite a few different things together, things that we've planned in, but also just kind of ad hoc things that have come about that we've needed to work together on. And one of the main things we've done is make changes to our town centre uses supplementary planning document. I'm not going to go through the whole history of why we did that, because it's quite a long story, but we worked together to do a bit of a light touch refresh on some of our restrictions. So we took our restrictions down, we about halved them in terms of hot food takeaways. So we used to be 10% of our units in our town centres could be hot food takeaways. We reduced that to 5%. And then on the smaller kind of district shopping parades, the smaller retail centres, we went down from 20% down to 10%. So because of that restriction, it meant that no other hot food takeaways could open in our town centres unless one closed and freed up that unit for another one to move into. So that was a really successful policy. We have successfully refused some new applications based on that new restriction. Others we've had to allow, say for example on some shopping parades, you know, there might not be any hot food takeaway there at all, so we've had to allow one to move in when they've applied, but the numbers have been quite low. In terms of outdoor advertising, so as Charlotte said, we're one of the authorities that have also adopted the outdoor advertising policy. So that restricts any advertising of food and non-alcoholic drink on our council-owned sites. We've had ours in since January 2024, and in that time we've refused just one advert, which was on a roundabout sign, but you know, shows that we're having some kind of small impact, and we're looking at increasing the scope of that now, so moving beyond just food and non-alcoholic drink onto other health harming commodities. Another piece we've worked with planning on is our health impact assessments. So we created a bespoke template for Knowsley. So for any developers coming into Knowsley on housing or industrial sites that meet our requirements, we ask them to complete a health impact assessment. They don't have to use our bespoke template, but they can if they want to. And we've got a piece of guidance that goes along with that, that tells them kind of what we want them to consider when they're filling that in. So what data we want them to have a look at and how we want them to look at our existing communities that they're moving into and how they can increase access to good quality food that exists already, but also some of those, you know, considerations around growing spaces, and how that new community, if it's housing or if it's employment, how that new community using that space will be able to access good quality food in whatever format it is that they need, whether so it's housing or it's somebody who's working there and they need to access somewhere for lunch. We're also working together in terms of levelling up planning applications. So we were lucky enough to receive some levelling up fund for Halewood. There's 2 sites that have got pre-application planning discussions going on at the moment, and I've had a good couple of meetings with the developers on those about what we'll be looking for in terms of their planning applications and the health impact assessment that comes along with that. One of the conversations has been around retail unit space that will go up for sale as part of that plan. So we're having a look, we're sort of trying to nudge them away from your usual culprits, your Greggs and your Subways, that type of thing. So I think probably we will end up getting some kind of home bargains type unit But we're still saying to them, you know, what can we ask that company to do in order to make their offer a little bit healthier, or in order to put something back into that community? So we're still having those conversations. They're ongoing as well. There obviously are some challenges around this. It's not all good news. Our town centres, lots of them have lots of empty units. Units are closing, and you know, it's difficult sometimes to sell that health side of things. We don't really have the concrete proof that one more takeaway on our high street is going to cause X number of people to tip over that bracket into overweight or obesity, which is really difficult to quantify. But obviously the actual income that we're going to get from renting that unit out is very easy to quantify. So it's very difficult to make that argument sometimes. And we all know there's that pressure on council budgets. We need our units to be filled. We need to increase our business rates. We want to increase footfall, to increase our vibrancy. So yeah, difficult sometimes to have those conversations, but I have to say our planners are very good at taking that on board from us. We have a couple of units on like industrial sites that are becoming sort of drive-through type places. And again, that's sale of land. So it's companies that will move in and build the unit and operate from there. Again, we're trying to say, you know, can we think about what businesses we put into these places? But there is still that argument about income coming in and which units are going to work well in those spaces. So it is constant you know, conversations going both ways. We don't always get our way in public health, unfortunately, but we're just trying to keep that momentum going and those conversations going. So I did say that we have refused some hot food takeaway applications on our new town centre SPD. That is true. One of the ones that we refused, unfortunately, then resubmitted and opened as a restaurant. So that's that discussion we were just having. Hot food takeaway is in a category of its own in terms of planning, where we can refuse them because that's covered under our SPD. But a restaurant is completely different under planning laws, and Scott will tell me if I've gone wrong. But so we couldn't say no to the restaurant, but I would imagine that that restaurant is probably still doing quite a lot of takeaway trade. So, you know, it's not all good news on the hot food takeaway refusals. Some people do manage to flip around the net. I've just put advertising on there, not particularly related to food, but a lot of it is food. I've said we've got the policy on our council-owned sites. That's only a very, very small proportion of the advertising space across Knowsley. So we are still bombarded all the time with big billboards of food that is not good quality, high fat, salt and sugar, ultra processed type food, and we don't have any control over what's shown on those billboards. And the I think they're called 6 sheets that sort of flip around in our town centres, where we're given planning permission to have those in, but we've got no control over what gets shown on them as well. So we're in the process of collecting some qualitative evidence, which I'll go through on the next slide, to help us understand a little bit more the challenge around food access for some of our residents, particularly in our food desert areas, and hopefully some young people as well, so that we can really start to get to grips with what they need, and think about how our regeneration programmes can support that in the long term. I'm going to hand over to Scott to take you through the technical planning stuff, and then I'll do the final couple of bullets.
Thanks, Esther. Yeah, just on local plan development, in a report going to Knowsley Council's Cabinet this week, officers have recommended to members to start a new local plan for Knowsley in response to the updated NPPF. Officers are proposing to commence scoping and early participation for a new local plan from October this year. The local plan will identify priorities, and it's envisaged that health will be a strategic objective that will run through the local plan alongside other strategic issues such as affordable housing, economic development, climate change and good design. As part of the preparation for a new local plan, officers will prepare a suite of topic papers or technical papers as part of that evidence gathering phase prior to early scoping and participation. And the topic papers will highlight a number of key issues for the local plan to consider. There are a multitude of factors that can impact on health and well-being, but the topic paper will aim to focus on those areas where planning policies can have an influence, e.g. The link between obesity, hot food takeaways, active travel, etc. With regards to the NPPF guidance on fast food outlets, very much of the opinion that if new national development management policies don't encompass the NPPF guidance on fast food outlets, it's maybe something that we need to address through the local plan itself, utilising local evidence. A range of policy documents and strategies can have a major influence on the local plan at national, regional and local level. For example, Knowsley's corporate plan, Knowsley's housing strategy and other plans and strategies which relate to green spaces, climate change, health and well-being, such as the healthier weight strategy. Okay, Esther, over to you again.
Yeah, thanks. So I touched on that we're going to do some evidence gathering. So we've got a couple of different projects happening, which is hopefully going to inform our future progress. We're part of the No PH project, which is an NIHR funded project where if I can get this right, they are sort of understanding how NIHR research can be used by local authorities. So they're bringing the existing research together and making it kind of usable and linking it to local authority priorities. So we're part of that along with another 2 local authorities across the country. And we've requested the focus on hot food takeaways and also health impact assessments with a broader focus on health inequalities in general. And then we've got 2 research projects that have kind of happened simultaneously, but which will be really complementary to each other. One is we're working with Resolve Poverty and Sefton local authority as well, looking at food insecurity. We're going to be focused in the Kirby area of Knowsley, and Sefton it's going to focus on Bootle. And looking at food insecurity and poverty, linking that to the regeneration of Kirby and Bootle as well, and those plans for the town centres and how we can increase access to good quality food in some of those areas. And the other research project is around the use of Household Support Fund. We currently use that to pay for our food network effectively across Knowsley, for our social supermarkets and our food banks, but that funding will go. We know it will go over the next couple of years, so we need to look at who's using our food banks, who's using our social supermarkets, and how can we sustain that provision for them and make sure that it is good quality and it's not supermarkets leftovers that are not usable really in generating a good nutritious diet. So it'd be really interesting to see what comes out of those projects. I think that's all from us. I'll stop sharing in case anybody's got any questions for us.
Thanks very much, both. Really good, really comprehensive, and yeah, some good stuff going on in Knowsley. So thank you for that. And I thought a good explanation, Esther, as well about the complexity of public health stuff and the competing priorities. Is it better to have an entirely empty high street or a high street entirely full of chicken shops? Don't know the answer. Yeah, difficult and interesting. Thank you. Okay, if anyone's got any questions, save them up for the end, because I want to make sure that Helen, who I think is here now, has got time to give her talk as well. So are you there, Helen? Oh, hello.
Hi.
Hiya, you okay, Helen? Are you sharing your own slides, Helen?
I am. I'll just pop them up.
Brill, thank you.
That all good for everyone?
Yeah, all good. Thanks, Helen.
Happy days. Okay. Well, I'm Helen Armitage. Apologies if there's a bit of background noise. We're having our meeting within another meeting that's happening over there. Anyhow, so I'm one of the consultants in public health from Sefton Council, and this is kind of like a little 2-parter. So the first set of slides contributed by Ian Loughlin, who's like our local plan lead in the planning department in the council. And then I've added on some kind of thoughts of my own, more from a public health perspective towards the end. So some of the points that have been covered, I think, may recur. So I'll skip over those where possible. Yeah, so here's the first of Ian's slides. And I think he's making the very important point of obviously the inherent connection between place and land use and public health that we all know is there. And he summed this up really nicely in a meeting we were both at the other week. We were talking actually about our new health and wellbeing strategy. And he just looked across the table at me and he said, well, we both want exactly the same thing, don't we? Planning and public health. And I thought, yeah, that's so great to hear. And I could sort of really notice the enthusiasm. And why was he feeling so enthusiastic? Quite possibly because of the changes to the MPPF from December, which he's highlighted here, including access to healthier food. This is something I've also touched on later in the slides that I've put in, and the bit that was quite a late addition, I think, was this use of the term health inequalities in the MPPF, which 2 words, but actually stands for an awful lot in terms of what that's the meaning of that in our practice. So current local plan is from 2017, embarking on the next one in 2026. So Ian and I are going to be spending a lot of time together. We have in current plan quite sort of like basic provisions. So there's one about appropriate location with regard to other land uses. And then there's the other one, which I suppose is quite standard, around restricting hot food takeaways within a certain distance of schools. But I think Ian would say that he feels on much surer footing, I guess, in terms of expanding that. So he set down his thoughts about where we may go from here. So it's really good to see and I understand this from senior planners across the department as well, this idea of much bigger focus on what it is that makes for a healthy place. So one of the things I think we were looking to do this around the time that COVID came along. And so that derailed everything. But developing our own health impact assessment policy for major developments, of which there are several sort of very much in the offing or indeed underway in Sefton. And some additional approaches. So Ian's discussed here looking at restriction of hot food takeaways around areas that get a lot of footfall from children, and also kind of leaning in more to this, like diversifying land use, so more provision for allotments and growing spaces and gardens within new developments. I think that would particularly tie into some of our kind of like theories of change around what we would need to change to shift some of the unhealthy food exposure that particularly drives inequalities and things like obesity, and indeed other nutritional developmental problems. So we recently carried out some research that identified an inequality in the prevalence of childhood stunting, so not achieving potential height in Sefton as well. So interested to pursue that one. This business again of access, which Esther talked about in relationship to the research on food deserts. Sefton in particular, we have a pattern of the spatial distribution of our areas of wealth and our areas of poverty and deprivation. They're very discrete. So in other parts of the country and probably other parts of Merseyside, you'll have like more of a mix, either at borders, or you'll have like more fully integrated patterns of wealthy households and low-income households, such as you might find in different like boroughs in London. And what that means is that you may stand to benefit from some of those assets that are sensibly aimed at higher income households or required to serve higher income households, because you live in that same area. Whereas actually, for us in Sefton, often to take benefit from those different assets, that would include things like big supermarkets and things like that. There's often a travel cost to then actually getting yourself there, and in areas of like low car ownership, that's going to include like taxi fares and difficulties with public transport fares and there are lots of other compounding factors associated with poverty that are like related to poor quality housing and how housing is fitted out and these kinds of things that all kind of conspire to create quite a hostile food environment, I suppose, is one way of thinking about it. The final point here as well, provision of community spaces that could host food markets. I think where I kind of moved over to public health, I was a dietitian, and in my clinical practice, I never really lost sight of the fact that eating and drinking is inherently like a social thing that we do, and participation in a healthy food culture with other members of our community is a simple thing that in some ways we've lost, and we've particularly lost in low-income households. So again, bringing those things together, like social well-being as well as nutritional well-being, is something that Ian's touched on there. These are his limitations. I won't focus on these too much because we're very glass half full, but the idea that we need to develop really more holistic approaches to shaping the kind of place gender around healthy eating is, I think, one we should really take to heart. And I've included a few comments just at the very end of my little section to think what that might mean around like workforce as well. So the next few slides I've really just put in as, I guess, prompts. There are more things that I've come across that I've squirreled away and that I know are going to help the development of the new kind of policies and plans that Ian and I should be working on over time. And if you're not using them, maybe they might help you too. They're definitely things we're thinking about. So so that I've just referenced, I think there's 96C, the fateful sentence, reduce health inequalities. So just for us to be clear, that's obviously about, that relates to decisions about resource allocation and the attention we pay to different things in different areas. So it's not so much what you put in, it's to do with like the intensity, I guess, of your policy intentions. So I think that does add in some ways an additional layer of complexity that we're going to need to work through, but we're thankful it's there. So mutually supported plans, of course, and I've heard others making links to this. So this just happens to be, this is from our Sefton child poverty strategy, but you can see, so here we're talking about planning tools and frameworks with meaningful community engagement. That's something we know we need to do more of. Exploring opportunities for low-income families to participate socially on equal footing. So thinking about in things like the Strand redevelopment, is there a possibility of using like social investment, community enterprise models to create like, you know, eating out opportunities that are healthy and maybe linked to local growing, so you can, so families from every income group get the experience to come together and have like the same nice time, and hopefully, you know, maybe be a bit inspired and come into contact with some new foods and things like that along the way. And looking at ways we can maybe couple that to pay it forward type business models so that cost is not a really big deterrent to engaging in those shared experiences. So, yep, that's from our child poverty strategy, and that's the place aspect of that. And then at the bottom, we've included the current, one of our current ambitions from the health and wellbeing strategy, which is also due for refresh at the moment. I like this one. It says, the places where we live will make it easy to be healthy and happy, with opportunities for better health and well-being on our doorstep. I mean, if we didn't change that, I'd be really happy. I really like that one. So mention community engagement. So I guess you'll pretty much know the Place Standard tool. I noticed they've just recently introduced this version, which is aimed at like the design stage. So that's probably something we're going to look at a little bit more closely to see how we can maybe apply that to some of the regen work and plans that are being put in place at the moment. I love Place Standard because it's got like something for everybody, whether it's people with learning communication needs, town centre toolkit, old people, you name it, it's in there. I've called this new and overlooked data tools. Look, many of you may know this, but I think this is a great help to us. So this is the Healthy Cities generator, and the good thing about this is it allows you to like either plug in the changes you'd like to make, for example, to the food environment in a defined area, and then look at the health and the health economic gains, or you can say, I would like to achieve like the health and health economic gains to help basically level up a community. What would that look like? So what kinds of spatial interventions would I need to put in place? So that's like the intensity bit in order to achieve that. There's free and there's paying versions. I think this is something we are looking to invest in Sefton, and it's got, like the Play Standard tool, it's very evidence-based. Global burden of disease. So this is basically an epidemiology tool, and it's what the NHS based their big last long-term plan on. What a lot of people don't know is that data from a global burden of disease is available at local authority level. And so this is something we sometimes use when we're talking obesity to make the case much more clearly that we're not just talking about obesity as one big thing. There's also independent risk that comes from the poor quality of the diet. So we need to be thinking about things that tackle both the quality of the diet and the energy density and energy expenditure when we're thinking about these place-based models. So this is really good to be using for your case making. Oh, and Matthew's got his hand up. Have you got a question, Matthew?
I think it's just warning you that you've got a minute left.
That's fine. I've got a slide left. So this was my, these were my final thoughts, I think. I think there's a deal of complexity around all of these issues that we're describing. They are inherently complex issues. Public health is pretty complicated. Planning system's pretty complicated. And I think we need to pay some attention along the way to workforce development so that we are doing more kind of grow your own in terms of like bilingual staff who can speak the jargon of planning, can speak the jargon of public health, and are also skilled at engaging with communities and so on and so forth, so that we're in the best position to take advantage of these positive changes we're seeing coming through the system. So that's it for me. Thank you very much.
Well, thanks, Helen, and perfectly timed. Right, we have got a few minutes if there are any questions. I didn't see any coming up in the chat. So please do raise your hand if you want to ask a question of any of our local authority colleagues. That was really good, that though, Helen, and colleagues as well. It's great to see so much good work going on locally. So thank you very much for that. We have got a couple of questions, I think. So Matthew first and then Robin.
It was pretty easy, dead quick. Just some of the stuff that both Helen and Esther referenced in terms of the food access work. If there's anything you could share on that in terms of that piece of research, that sounds really interesting, and perhaps we can share that with the rest of the group. But perhaps you can just share that offline. But that would be really interesting to follow up on.
Yeah,
we can, Matthew. It's not started yet, so give us a few months, and we should be able to share something, I think.
Thanks, Esther. And Helen, it'd be great just for me, because I hadn't heard of a Healthy Cities generator. So if you can have the Play Standard, which is good, but if you can just put the links to those in the chat for anyone else who's interested in looking those up, that would be grand as well. Thanks.
No worries.
Robin?
Yeah, just a quick one. Thanks ever so much to everybody. Actually, really interesting and really, really valuable toolkit, but also to hear that, what it's actually like on the ground. I totally take in, say, Esther's comments about the difficulties and the pressures on when you got vacant units and what you can do. I just wanted to ask a general question, and I apologise if anybody did say this. I didn't particularly pick it up. Do you find your elected members have been very supportive of this process? Because I imagine that can be very important in how far you're able to push some of the planning regulations, planning guidance. Would anybody like to comment on that at all, if that's relevant to them?
Robin, we didn't have any kickback at all on reducing our restrictions, and I think when you put it in the context of some of particularly the childhood overweight and obesity rates that come out of the National Childhood Measurement Programme, they have to make quite a good argument to not do it, and we can say we've got plenty of these, we're not restricting choice, and examples of what other units have been used for. I think actually elected members are quite protective of their town centres and their shopping parades, and they also don't want to see them full of different types of hot food takeaway. So we certainly didn't have any pushback.
Thanks, Esther. Okay, so in the absence of any more questions or any more answers, if we can just go on to, thank you, Beth. So next steps, I'll read these out. Obviously, it won't be me, it'll be the team. So please do feel free to join us as well. So the recording is going to be shared with links to the live toolkit as well after today's workshop. Nicola did mention before, there's going to be further comms in disseminating the resource further as well. I'm sure the team as well would also like any feedback of anyone that uses it, because it will be reviewed and refreshed. So any new case studies, it can be updated in line of updates to the NPPF and other national work as well. And there's going to be further consultation as well around engaging stakeholders to further develop this work and also learning opportunities from the new stuff that's happening nationally and how that can be incorporated into the toolkit. So on the next slide should give you the link to the toolkit as well. Yeah, Matthew's put it in the chat as well. So that's grand. Oh, and yeah, and there's the email address to send any feedback for anybody who uses this as well. So please do that, because I think it's a good tool, but it's also iterative, and if it can be improved, I'm sure it will be. And that's more or less it then, I think, other than to say thank you, unless anyone from the Health Equalities Group has got anything that they'd like to sum up. I'll let you all have a whole 90 seconds back of your afternoon. Yeah, no, all good. Brilliant. All right. Thank you very much, everybody.
Thank you.
Thank you.
Thank you,
Bye.
Andy. Cheers now.
Bye.
Bye, everybody.
Thank you.